All right, so for this week's research spotlight, we're looking at a systematic review. So the effectiveness of diaphragmatic breathing for reducing physiological and psychological stress in adults, a quantitative systematic review. The study was from 2019, I believe, and basically this study looked at how diaphragmatic breathing can help reduce stress and what the literature is kind of saying about that. So the systematic review isn't a great systematic review. When they went through their selection process, they only narrowed it down to 3 articles, just because there was a lot of duplicates or a lot of studies that were not high quality or were not controlled, or the variability between all the studies was too different. So they only narrowed it down to 3. So this systematic review is only based off of 3 articles. So that is a limitation. And then all of the articles are low to moderate levels of evidence, either kind of looking at an intervention, or I think there was one that was a randomized controlled trial. But basically what they looked at was diaphragmatic breathing, and they assessed systolic blood pressure, diastolic blood pressure, respiratory rate, cortisol levels, and stress and anxiety. And based off of the 3 articles that they reviewed, they found that diaphragmatic breathing does in fact help reduce systolic and diastolic blood pressure, and it also helps to reduce cortisol levels, which we know that cortisol is a marker for stress, and helped also to reduce respiratory rate. So those are some physiologic signs that they found diaphragmatic breathing was effective at reducing, which is kind of an indirect measure of stress. You know that when people are stressed, typically their sympathetic nervous system starts to take over, and they get those increased blood pressures, increased heart rates, increased respiratory rates, higher cortisol levels. So those are kind of an indirect but very measurable physiologic signs. And then one of the studies looked at a depression and anxiety stress-related scale, and they saw improvements with that scale too. So this, as a physical therapist, something I'm kind of thinking about is, okay, that's something that if I know a patient gets anxious about coming into therapy, or they're anxious about their pain levels, or kind of any performance, then we can help teach diaphragmatic breathing. It's something I teach to a lot of patients. Once again, this study is a little bit on the lower side of evidence in terms of systematic reviews, just based on the strength of the evidence that was used within the study and the number of studies that were used. But I think it's a good article to kind of bring some light into the fact that diaphragmatic breathing does work. And I hope to bring some more diaphragmatic breathing articles, because this is something I am interested in and I'm kind of passionate about. And I might be doing some diaphragmatic breathing work with a few groups of people coming up. So kind of going to be looking into this literature a lot more. But so yeah, those are kind of my big 3 takeaways. And then another, so one, I guess my big takeaway would be that it is effective at helping reduce stress and kind of the physiologic markers of stress that we typically look at. And 2 would be that we need a lot more research to really quantify how well diaphragmatic breathing works on stress, and how I think there needs to be more research in how stress is perceived based on diaphragmatic breathing. And this article kind of brings me back into the point of the quote of the week that we shared yesterday, because the quote of the week kind of talked about confidence and how confidence is related to being able to control your body. And I think that based on the evidence that this article presents, being able to kind of help regulate blood pressure and respiratory rate and things like that, diaphragmatic breathing can also increase confidence if you kind of buy into that language in terms of what confidence is. So just a few considerations. Hopefully you enjoy this article and have the time to look it up. So thanks for watching.